BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering private MRI and CT appointments in as little as 1 to 2 days. Visit canadadiagnostics.ca.
Doctors often hear patients complain of night sweats. There are many common causes. Our health specialist Leah Sarich is here now with what they are, when we need to be concerned.
Yes, there is something to talk about there for sure. So this all started because, as you know, I was having these night sweats and I thought, okay, this is a little early for menopause, right? What's going on here? Turns out this is an incredibly common occurrence. So I spoke with Dr. Raj Bardwaj about this, and he says there are so many things that can be causing night sweats, but we first have to rule out the environment. So your room can't be too hot. It can't be that your duvet is too heavy or you're wearing pajamas that are too hot. So rule that out, first of all. Keep the temperature really cool in your room. And then if you're still having them, then there's something here that we need to investigate. And here's what he says are some of the most common causes.
I think the most common cause would probably be something that you ate. So whether that's a lot of protein at dinner time or some alcohol can cause night sweats. And then over-the-counter medications. So sleeping medications are really common. And one of the most common, I would say, are ibuprofen, which is Advil or Motrin, and acetaminophen, which is Tylenol. Those have a very common side effect of night sweats, and people don't put those two together.
Well, no.
And I didn't either until I did my own little clinical trial in my house, and I figured out that's exactly what it was.
What was your clinical trial?
My clinical trial was if I take Advil or Tylenol before bed, what's going on? And I was getting the night sweats. So as soon as I stopped taking those specific pain medications before bed, magically they went away.
Did you play with the other factors as well? Protein and alcohol?
The protein and alcohol might have something to do with it, but we don't need to get into that.
Okay, but I understand. All right, that's really good to know.
Yes. The other thing we actually have to do is define what we're talking about when it comes to night sweats. So again, this isn't just like I'm feeling a little bit hot. This is clinical, the clinical diagnosis of it is, so you've got full-on drenching sweat where you literally have to change your pajamas or maybe even change the bed linens. Okay, so major, major sweat, not just a little bit hot and sticky, major sweat. Okay. So that's what we're talking about. So now the other thing that comes up obviously is what about menopause, right? So obviously menopause can cause night sweats. For sure that can happen. But the thing with menopause is you can easily rule out a lot of other things. So if you are too young or too old, so a 40-year-old or a 70-year-old should not be having night sweats due to menopause. So easy to rule out. But of course those are hormone changes that are causing those night sweats when it comes to menopause, and certainly changes in hormones can cause night sweats. And if that's the case, your doctor will investigate things like your thyroid or your pituitary gland, which control hormones in the body. So that's definitely an option. However, there are a collection of symptoms. So when you come to a few different things together, that can actually be quite concerning, and Dr. Bardwaj explains why.
If you're having night sweats and weight loss, or unexplained fevers. And remember, fever is not just touching yourself on the forehead or getting somebody to touch your forehead and say, ooh, you have a fever. No, that's a temperature of 100 degrees Fahrenheit or 38 degrees Celsius or higher. So if you have fevers that are unexplained by infection, if you have weight loss that you're not trying to lose, and night sweats, boy, you should see your doctor sooner rather than later.
Okay.
So of course I had to ask, why? What could it be? And actually, the collection of those three symptoms together can be an early sign of cancer. So you want to get those things checked out right away. And again, let's be very clear that people who have night sweats and weight loss and a fever, they do not all have cancer, right? Let's be very clear about that. They do not all have cancer. However, those are that's something you really want to rule out. So they're going to rule that out right away. We want to get rid of that for sure. The other thing you want to pay attention to are those hormonal fluctuations that happen throughout the day. So you know what, like at 10 o'clock in the morning, you're like, geez, I need another cup of coffee, or at 3 o'clock in the afternoon, you just feel, I'm feeling so sluggish. That happens at night too. Oh. Yeah, so you're having all of these things, these hormonal fluctuations happening at night. So that, in fact, can cause a night sweat as well.
The body is a mysterious machine.
It sure is, and of course, there's even more causes, and they're on my blog.
On Leah Sarich's blog, breakfasttelevision.ca. Thank you for helping sort that out for
You're
us.
welcome.
For those of us who are of a certain age who might be wondering what's going on.